Hello and welcome to Crossing Bridges. Ladies and gentlemen, today my guest is Dr. Keith Valone, the clinical director of Arroyo Psychological Association, who has been practicing in the city of Pasadena at this place for since 2004, but also Dr. Valone has been practicing in our city for the past 30 years. He's well known, highly respected, and has given much gift to many of his patients who reside not only in Pasadena, but all surrounding cities. Today, you are going to have an opportunity to hear from Dr. Valone. What are some of the symptoms and causes that creates problem within family structure without knowing what they are? We're going to talk about psychological effects on not only the family, the pain, suffering, as other matters that takes place. So without any further ado, it's my pleasure to welcome Dr. Keith Valone to my show. Dr. Valone.
Thank you, Ned. Thank you for inviting me.
It's my pleasure.
Yeah.
Thank you for coming to my show. I really appreciate that. Having known you for several years, it's really been a delight. And having checked your background, it's really awesome, fantastic. And the Arroyo Association Psychological Incorporated basically is a very profound organization that is needed. And the way you serve the community and serve the patient, which I like tremendously, because many places, as soon as they get a patient of psychological problem or any other stress problem or whatever else that might cause them to come to see you, the first thing those clinics or doctors do, they provide medication. Now, you don't do that unless it's absolutely imperative. You actually promote the cause of what they have to them understand, work with them, and at the end, if there's necessity, you do that. Now, let's talk about the premier function of the Psychological Association, please, if you'd be so kind.
Sure. So we're a group practice of clinical psychologists, marriage and family therapists, art therapists, music therapists, and we have a psychiatrist also that consults with us. So we are a multidisciplinary group of mental health professionals. And our core competence is with psychologists, of course. And psychologists diagnose and treat mental disorders, and we use psychological testing, psychotherapy, and then, as you say, when necessary, we also use medications. And medications can be very helpful in certain conditions, and in other conditions, medications really are not very helpful. So it really depends on the diagnosis and the condition and the situation. But with every patient, we use psychotherapy.
Right. Now, a lot of families might have within their scope a person that has obstacles, they would not know what the problem is. Like, let's talk about bipolar. What is that? How does it affect the individual? And how does it affect the family from the standpoint of suffering, pain, anxiety, and so forth, if you'd be so kind?
That's a really good question. But we think of bipolar disorder as a spectrum of different disorders, from more severe, which we call bipolar 1, to milder forms of bipolar disorder. So it's a group of related kinds of disorders. And the hallmark symptom in bipolar disorder is something we call mania. And mania is a period of elevated, expansive, or irritable mood that's different from the person's normal mood. And this mood state may last 4 days or longer, 4, 5, 6, 8 days. Occasionally it might even be 2 or 3 weeks. And that is the most important symptom in order to make a diagnosis of bipolar disorder. So the person may be happier than normal, more cheerful, almost like they're high on drugs, except they're not using drugs. Or the other type of presentation for mania is somebody become very irritable, short-tempered, snappy, aggressive. In extreme cases, they might be throwing things, breaking things, assaultive. Those are the very severe cases. So the first step is seeing if they have the change in mood. Again, that's not due to drugs, and it's not due to a medical condition. After that, you look for several other symptoms, and the person has to have 3 or 4 of these other 7 symptoms. And those symptoms are change in self-esteem, so the person has an inflated self-esteem, they feel better about themselves than they normally do. This is during the period of mood change. The second is they become more distractible. They have a harder time keeping their mind focused. The third symptom is something called pressure of speech. They're talking very rapidly, more than normal. The fourth symptom is called flight of ideas. Their thoughts are going very rapidly. The fifth is decreased need for sleep. The person has insomnia. They're sleeping maybe 2 or 3, 4 hours a night. The sixth symptom is kind of a mouthful. It's excessive involvement in pleasurable activities that have a high potential for painful consequences.
Yes,
So the person might be doing drugs, they might be on a spending spree, they might be driving really fast down the freeway, they might be sexually inappropriate, anything that's really pleasurable that they wouldn't normally do if they were in a regular state, but they're doing in this state. And the last symptom is excessive devotion to work-related tasks or other kinds of tasks. So they might be, if it's a housewife, she might be cleaning the house over and over and over again, or somebody who's working might be working 90 hours a week. And they wouldn't normally be doing these things.
What does the family need to do to make sure that their loved one who is bipolar gets attention right away and hopefully be cured of that?
That's a really good question, because the research shows that people with bipolar disorder are often the last ones to know. Because mania often feels good, it's pleasurable, the person's feeling lots of energy, creative ideas, and they don't really realize there's something wrong with them. The family, however, around them sees this problem. They're aware of it, they're worried about it, they see the spending, they see the other consequences that are risky and problematic, the arguments, maybe the problems at work. And so the family sees this problem, and the patient often doesn't want to hear about it. Or the person gets arrested, or other serious consequences. And so one of the treatments for bipolar disorder is family therapy. It's an important type of treatment. So often what the family can do is they can look on the internet. There's a lot of good information about bipolar disorder on the internet. National Institute of Mental Health has good information. And if that isn't enough, or if the family member is getting too ill, then make an appointment with a psychologist. And sometimes we start with the family even without the patient. And so we'll start with the family. We do something called psychoeducation, where we teach the family about the disorder. We explain what the disorder is. We talk about the different kinds of psychological and medication treatments, and then we help the families become experts.
You mentioned that negative effects could be severe in some cases.
Yes.
And I'm sure people who love their loved ones do not, God forbid, go through having someone, for example, to receive a call from a police department that your son or daughter or your mother or father, God forbid, hurt someone, because that could be a possibility. They can hurt people or hurt themselves.
Or themselves, right. They could be assaultive, aggressive, they could be suicidal, and they could also do things that were not intentional because they're not in their right mind. I mean, they might walk in the middle of the street because they're not aware of their surroundings and what they're doing. They might get hit by a car. They might get into an argument with somebody at the grocery store, like a checker, and then the manager gets called, and before they know it, then the police get called. And they're not trying to do this. They're ill. They're not bad people. They're just sick.
Is that genetic within the family?
So there's a large genetic component to bipolar disorder. It's probably one of the most genetic disorders of psychiatric illnesses. So it tends to run in families.
Are some of the families perhaps embarrassed to want to face the reality that they have someone in their family that is bipolar?
Right. Sometimes that is an issue, that there's embarrassment, or also did it come from my side of the family, or her side of the family, or his side of the family, and trying to deal with the shame or embarrassment sometimes becomes a problem. And I think the most important thing for those kinds of things to realize is it's not any different than if your family has cancer or high blood pressure, or this is an illness. It's not a weakness or a personality or a bad character. It's a brain disease. It's a chemical imbalance.
And the sooner they receive help, the sooner, hopefully, you will resolve their problems. Because I know I've worked with a number of autism children, and some, I don't want to label any groups, for example, but I know they're ashamed of stating that I have an autism child. And many of them are not aware of what they need to do with that child, where to seek help regarding diet, teaching, and so forth. And when you really approach them that you really have obstacles with a child, then gradually they come out of being shy, being embarrassed. And of course, at the early stage, the sooner you give a child the necessary tools of seeing a medical assistant, the better it is. And I'm sure the same with bipolars.
That's absolutely correct. The quicker you intervene, bipolar disorder can have an onset in early adolescence of 15 to 25. And then there's another group that has onset in their 30s. And the sooner you can intervene and get help, the less severe the course of the illness is. And there's quite a bit of research that shows that if you don't treat the disorder, it will likely recur again and again and again. And as the person goes into their 30s and 40s and 50s, it may even cause brain damage if you don't treat it. And so you want to treat it rapidly, quickly, aggressively. We have excellent kinds of treatments where we treat what we call active phase, where the person is manic, or they can also be depressed. That's why it's called bipolar mania and depression. And then we have our psychological treatments. A lot of them are designed to prevent having future episodes. And so they're very effective treatments, and the quicker you can get the patient into treatment, and also the family into treatment, because the families are one of the most important sources of helping to prevent these episodes.
There's a saying, you got to know your family, especially children. If you see mood swing, if you see changes, there has to be something wrong. A lot of parents, unfortunately, are not aware of that.
Right.
And they let the child go on with that change, and God forbid, it is something of serious nature, which they could have prevented by taking action. Is that correct?
That's correct. And there's another really important message I'd like to get out to your viewers, which is that the family did not cause this. Okay, so there's a lot of research that has looked into over the years, is this something that parents did to their child? Did they cause this to happen? Was it bad parenting? Absolutely not. There's very clear evidence that it has nothing to do with how the child was raised or the parenting. It's nothing to do with that, and so it's not the parent's fault that the child has this problem. Again, it's just genetic, it's just brain chemistry,
Yes,
and
sir.
so the parents are not at fault or to blame for this, but they can be a huge source of support. When the families come in for treatment with us, we greet them as part of our team, you know, and we teach them, we empower them, we educate them, we don't blame them. It's, again, it's not their fault.
Absolutely, right.
We're here to help them, you know, help them help their child and also help them help themselves.
Now, you mentioned the 6 symptoms, basically, that people can associate with bipolar. Also, for example, I was studying about some other effects that takes place within the household of individuals who, for example, if they take long, long showers, which is not normal, for example.
Yes.
If you sleep long hours, for example,
Correct.
a sign of depression.
Correct.
And doing so many other things that some people might say, well, it's okay, let him take a long shower. Oh, let him sleep, he might be tired. Are those also some other symptoms that is giving you a little hint there's something wrong with that family member?
No, those symptoms may be more depressive symptoms. Now, bipolar is sometimes they're manic, sometimes they're depressed.
Right.
So depressive symptoms, and again, if you have one symptom, that doesn't really mean anything. It's nothing to worry about. I mean, if your son is sleeping 10 hours a day for 5 or 6 days, that doesn't mean anything. We don't make a diagnosis for something like that. That's why it takes several symptoms to make a diagnosis. But sleeping for very long periods of time, or which you call hypersomnia, or the opposite, which is insomnia, weight gain or weight loss, problems with attention, concentration, memory, and decision making. That's a classic symptom of depression. Low self-esteem, suicidal thoughts or feelings, walking around slowly, sort of like the person's on slow motion, or fidgety, agitated, can't sit still, restless, is also a symptom of depression. It's called an agitated depression.
And please expand, what are the remedies, what are the things you would do, for example, to assist a family who has someone with that category?
Right, so we would try to help them. We would do family therapy, and then we would also have some treatments for the patient. So let me briefly go over the treatments for the patient. So there's, for psychotherapy, there's something called cognitive behavior therapy, or CBT, and that therapy helps the person change the way they think about themselves, their condition, and through changing your thoughts, it may change your feelings, and it may change your behavior. So one is CBT. A second one is called interpersonal therapy, or IPT, and that has to do with changing the way you relate to people and the quality of your relationships. In depression, it's IPT. In bipolar, it's IPSRT, which is interpersonal and social rhythm therapy. The social rhythm part is getting people to go to bed at the same time, wake up at the same time, get their 24-hour cycle stabilized, because with mood disorders like depression and bipolar, people are often up all night, sleeping all day, all over the place with their sleep. So in IPSRT, we really work on what we call sleep hygiene. Going to bed, staying asleep, getting out of bed, no naps during the day, very, very structured routine, in terms of how we do that. That's the IPSRT. And then the third one is, again, these are scientifically proven theories, is family therapy. And so we get the whole family in. We do a lot of psychoeducation, educating the family, have the patient be the expert, have the patient explain their symptoms, what it's like to have these disorders, have the family talk about what it's like to go through it. And as the patient stabilizes, we create what we call a rescue protocol, which is, okay, things are better now, you're doing better now, hopefully no more episodes. What if one starts to happen again? How do we intervene really quickly so that this goes like this rather than like this?
Right. A lot of families are in denial, Dr. Valone, because they look at it, well, everything's going to be okay as you indicated. Right. We don't need to get outside help, or again, being ashamed, or perhaps sometimes because of monetary and so forth.
Right.
Can you expand on that, please?
Yes. Okay. So there's support groups for bipolar disorder and depression. Many different kinds of support groups. Again, I think if people Google support for bipolar disorder, for depression, you'll find a lot of support groups. Some of these are free at no cost. So there's treatment and support for everyone. And again, depending on people's financial situations, there's low-cost treatment available, insurance treatment, and cash payment. There's all kinds of treatment out there, but there is treatment for everyone out there.
What are some other things that parents should be looking within their children, for example, besides bipolar, depressions, and so forth?
Well, another complication that can sometimes happen with these disorders is what's called psychosis.
I see.
Psychosis is a break with reality. And so a small percentage of people with bipolar disorder also have psychosis, and a small percentage of people with depression, severe depression, can have psychosis. So we have three different types of symptoms with psychosis. One class of symptoms are called hallucinations. And it's really simple. Hallucinations are false sensory perceptions. We have 5 senses, and you can have hallucinations in any sense. So the most common are auditory hallucinations, hearing voices, hearing things that other people can't hear, most common. And second one is visual hallucinations, seeing things that other people can't see. Most commonly, visual hallucinations are caused by drugs or by something like a brain infection, something like that. But that's the second type. The third is olfactory hallucinations, smelling things that other people can't smell. The fourth is tasting things that other people can't taste. And the fifth is feeling things that other people can't feel, like things on your body or inside your body. So those are hallucinations. And again, these are usually neurobiological or psychiatric, neuropsychiatric symptoms. The second type of psychotic symptoms are what we call delusions. And delusions are false beliefs. So 3 common examples would be paranoid delusions, that someone's trying to harm you or hurt you when there's no proof or evidence that that could happen. A second type of delusion that's common in bipolar disorder is grandiose delusions, that I'm a famous person, or that I'm Jesus Christ, or that I can touch things and turn them into gold, or things like that. So that's a grandiose delusion. And a third example would be a delusion of reference. And that is like if the person's watching television and they think that the television is about them, like a TV commercial is specifically about them. Rather than it just being a regular commercial.
It's amazing you brought that up, because when I was going to college, I was doing part-time job as a sanitarium on East Del Mar. And I used to be delivering food to various patients. And lunchtime, we used to sit with the workers and have lunch. And there was a gentleman who pretended to be a director, a movie star. And I was young, and I was always interested to be in the movies. And I believe in this guy to truly be a movie star, a director. For the duration of 6 months I worked there. Finally, I went to him and said, can you help me? Can you get me the movies? And so forth. Then somebody tapped me on the shoulder and told me who he is. And that I never forget that. And they can become really real to feel that they are that.
Yeah, it's a grandiose delusion, and it's a very common type of thing. And then the third class are called thought disorders. And a thought disorder is an experience that someone is inserting thoughts into your mind that are not your own thoughts, or removing thoughts that are out of your mind. So that's the third class. So those are the 3 classes of psychotic symptoms.
It seems that almost some families throughout the United States, and actually throughout the world, do have psychological problems in their families.
Right.
It's
very common.
You do not hear the extension of the seriousness, like, for example, till some, God forbid, negative factors or dynamic disaster takes place, such as shooting of children, or someone going to the theater, as you in Denver, killing so many people. Then suddenly the society comes together and they say, why did that kid get help? Why don't we do this and that? Well, this is the opportunity, as you are explaining, Dr. Valone, for the viewing audience to see that there are ways to get help.
Right. There are ways to get help, and I think it's also, there are lots of ways to get help. And we haven't talked about medication, we won't have time to do that today, but there are really good medications that help in addition to psychotherapy when somebody has these serious kinds of problems. I also think it's important to be careful not to stigmatize, because yes, there are people who have shot people in the movie theaters and so on, but that's a very, very small percentage. And so sometimes people don't want to say that their son or daughter is mentally ill because they're afraid that the people around them think they're going to get a gun and shoot people. And it's so uncommon. I mean, it is possible, but it's very, very uncommon.
I see. Well, what is the severest patient you have had in your clinic, basically, that you have been able to kind of help them and direct them to the right road? Because as I indicated, I have studied your background and your success rate has been fabulous.
Thank you.
Because of the team that you have. They're all professional, ethical, but more so you become part of their family.
Yeah.
And that's the key factor.
That's right.
They trust you, they believe in you, and you need to have that trust first in order to be able to direct your patient, if you'd be so kind.
Sure. I'm actually not allowed to talk about a real patient just because of confidentiality.
I realize that.
But I'm also on the medical staff at Huntington Hospital.
Yes, sir.
And so I can co-admit with a physician my own patients, and I am able to, it's called a 5150 hold, an involuntary hold, and I'm able to actually write involuntary holds in my office.
Yes, sir.
So if a person is a danger to themselves, a danger to others, or unable to take care of themselves, I can actually write a hold to put someone in the hospital against their will. And so it's a very serious thing to do, and you don't do that very lightly.
I see.
But sometimes you have to do it to save the person's life,
right.
you know, for self-protection. So sometimes, you know, you have somebody who is about to jump off the bridge, the Colorado Street Bridge, or they're going to, you know, go home and get a gun. I've had people bring a gun into my office before, you know, so sometimes very serious things. You know, write a hold, have the ambulance come, you know, across the street from Huntington, so they're just taking them 50 feet across, but they have to be transported in a, you know, in an ambulance. And then I've had people in the hospital 4 or 5 months, you know, because of the severity of their illness, and come out of it, and really their lives have been completely turned around. So, you know, sometimes some very ill people with schizophrenia, which is a brain disease with a lot of hallucinations and delusions, and there's extremely effective treatments for these disorders.
Well, basically, normal, the word normal means in normality, we should all live the way it should be. But of course, your points that are making are valid, because any parents who are watching the show today should recognize that if there's anything beyond the ordinary, beyond the normality of anything, could be a sign that is something brewing, something's happening. And it's imperative for them to get involved at an early stage to see why child, as I indicate, any family member is acting that way. And again, without embarrassment, seek help.
That's correct. As psychologists, we don't like the word normal, because everybody's different.
Absolutely.
You know, and there isn't like this one perfect normal thing.
Right.
What we really want is people to have rich lives and happy lives and feel good about themselves, and it's okay to be different in all kinds of different ways. What you want is happy, healthy people who are doing well.
Even without having any problem,
right.
People need communication, they need consultation.
That's right.
And what better place than to come to Arroyo Association, truly, I mean it sincerely, to get all the benefits of what you're offering, because you're not just offering one thing, you're offering.
We treat virtually every mental disorder, anxiety disorders, drug and alcohol abuse, brain injuries, pretty much everything. I mean, we have a large staff, and we can treat almost any disorders. I mean, some people have test-taking phobias or anxiety getting on an airplane, or not very big, you know, compared to these kinds of problems. But they still suffer. I mean, suffering is suffering. And if you can't get on an airplane because you can't go to visit your family, or you can't go for a job interview, that's a big problem to you, even though it might seem like a very small problem.
It can also be a burden on the family if you want to have a family vacation.
And then, it can be a really serious problem, even though you might think in the grand scheme of things it's not a very big problem.
As I indicate, all of us basically need someone to talk to. That's why they say have a best friend. But if an individual who has feelings that there is something wrong with that individual himself or herself should really seek
Yes.
assistance immediately.
Yeah.
Which is really the key point here.
That's right.
Okay. Are there any other advice that you'd like to expand on briefly for a few moments?
Just try not to be afraid. You know, seek help, whether it's with us or someone else. If we're happy to help people find help outside of our own practice, we're a good resource in the community. Like I said, I've been here 30 years. I know resources all over the country and happy to help find resources anywhere we can.
If you'd be so kind, can you give us the address, please, and the website they can go to?
Certainly.
Please.
Our website is www.thearroyos.org. It's TheArroyos.org. It's not .com, it's
Right.
.org.
Mm-hmm. And your address, please?
Our address is 1 West California Boulevard, and that's suite number 321, Pasadena 91105.
And the phone number, if you'd be so kind?
Yeah, it's 877-884-8272.
And one more time, give me the phone number and the website, please.
Sure, the phone again is 877-884-8272. And the website is thearroyos.org, and that's TheArroyos.org.
Well, Dr. Valone, it's been really a pleasure to have you here, and I'm very grateful that you took time from your busy schedule to be here to expand on some important things that our viewing audience need to learn about. Because psychological, I'll call it deficit, is not something that we can take for granted. We cannot say, well, it's going to go away by itself. It's imperative that we need to seek help, and no other better place that I can think of by coming to the Arroyos Psychological Association. And one more time, give me the address again.
Certainly, 1 West California Boulevard, Suite 321, Pasadena, California 91105. We're right across the street from Huntington.
Dr. Valone, thank you so much for coming on. It was a pleasure.
And thank you for inviting me.
My pleasure. Ladies and gentlemen, you have heard Dr. Valone expand extensively about some of the problems that you might have in your family. And it's not something to be ashamed of, because we all go through some obstacles, and that's what family life is all about. But families that stick together and seek immediate assistance for their loved ones are the ones who are going to come out of it together. So thanks for tuning in, and please go to the website and learn more about Dr. Keith Valone. Thank you and have a good day.